Here's exactly what happens when you come in for a wax removal appointment. I'm Andrej, an audiologist at Hear More Audiology in Walkerville. With microsuction, we usually welcome the person into the room and do a short medical history just to make sure that there's nothing that we need to watch out for during the procedure. I will use my otoscope and possibly my voroscope to start looking into the person's ear so we know what we're working with. With microsuction, as the name suggests, it is a little needle vacuum to suction wax out of the ear. So it should be comfortable. It does generate a little bit of noise, but at the same time it shouldn't create any real discomfort during the procedure. Person would sit comfortably and can pause the procedure at any point, so if they start to feel like they need a little break, we can stop at any point. There are three main methods of wax removal. Syringing was the most popular one up until recent times. The real difference is that there's no water involved. So you're not putting water into the ear to try and push the wax out of the ear canal. Obviously that carries a bit of a risk with it if you are using the water and the pressure, that it may do some damage in the process. With microsuction, we're removing the wax by suction. No pressure into the ear required. The other option is the curette, which I still commonly use these days. If the wax is a bit harder, doesn't want to budge, then we can use a little curette to try and gently pull it out of the ear. So the pump itself generates a little bit of noise, but there's usually no discomfort involved. The wax is either suctioned by the tube or it gets attached to the tube and pulled out of the ear gently. For a lot of people, they never really need to get their ears cleaned because the ears are generally self-cleaning. Some people who have in particular narrow ear canals or people who wear earplugs or hearing aids, there is a higher chance of the wax building up and not coming out of the ear. If you have a history of wax problems, wax buildup, maybe getting the ears checked every 6 to 12 months would be recommended. Is it satisfying? Look, in some ways it is. If I can remove the wax, that means I can properly examine the ear. For the patient, especially somebody who comes in with completely blocked ears, there is that immediate improvement and they notice a change straight away when the wax is removed. Same as for the hearing aid users. If it's constantly blocking up their hearing aids because they have a lot of wax in their ears, well, that's something that's satisfying in a way because they know they can use their hearing aid without the risk of them blocking up every time they put them in their ears. I had an elderly gentleman come in whose ear was completely blocked with wax. I was able to remove a very large chunk of wax, almost the size of my thumbnail, but then examining the ear, I noticed that something still wasn't quite right. Turns out it was the tip of a cotton bud, so ended up removing that as well, and that changed that gentleman's hearing immediately. He noticed a huge improvement, and probably another reason why you should never use cotton buds to clean your ears. You can read more about microsuction wax removal by clicking the link above, or you can get in touch via our website or give us a call. Thank you.